Thanks, Nina. So my name is Kayla Jock, and I am the Client Success Manager for VISN 6. And today we're just going to talk about a project that we've been working on at the Salem VA for the last 9 months, and how we improved hand hygiene practices through the use of Get Well technology and specifically Get Well Inpatient. So this slide here is just a quick summary slide of what we're going to dive deeper into in the rest of the presentation. But this opportunity came up because we recognized that hand hygiene was an easy safety practice that both patients and providers can participate in on a daily basis. And through this project, the Salem VA aimed to improve patient engagement in their own healthcare and then also address any continuing education needs for staff conducting routine bedside care. So the solution that we decided to come up with was a custom prompt that was launched twice daily to patients' TVs. So once at 10 a.m. and then a second time at 6 p.m. But through this prompt, patients were made more aware of providers washing their hands as soon as they entered the room, and then in turn their own hand hygiene habits. So we saw some really great outcomes from this project. Like I mentioned, it's been live for about 9 months now. But since then, the Salem VA has seen a 63% reduction in hospital-acquired infections. And the Salisbury VA also went live with this prompt about a week after Salem, but since then they've seen a 43% reduction in HAIs. So just a little bit about the Salem VA. This VA is located in Salem, Virginia, and it's a fairly large campus, but they have 242 beds, and it's a teaching hospital that provides healthcare services to more than 78,000 veterans in the area. And currently we have Get Well in 3 units, so 4J, ICU, and PCU, which totals to about 57 beds. So the data that you'll see in today's presentation is going to be based on the data that we've collected from those 57 beds. And with that, I will go ahead and pass it off to Mike. Thank you.
Good afternoon or good morning, everyone. So quick background there. So Salem and Salisbury, we'd gotten together. We're looking for ways to increase patient participation in our hand hygiene, which is a really good thing, a Joint Commission best practice, but it's really hard to execute. We also wanted to look at a way to see how our staff were doing beyond our secret shoppers. Because what you'll note is the secret shoppers, I'm sure many of you have seen this, you'll get anywhere 95 to 99% or so, everybody's compliant, but then when your IPs and NPCs go around, you'll find often much less. And it's always almost impossible to get anything from inside a room. So we went for doing this. It would hit both encouraging the patients to do hand hygiene and also seeing how staff were doing. There we go. Let's see. So it had been previously purchased. We at Salem had Get Well for a variety of different things. We got together in July, added that question when entering a room: did your healthcare worker, doctor, nurse, or other, wash their hands with their soap and water or use the hand sanitizer? So a very simple question, as you can see. And again, the goals were staff monitoring, patient education, and of course, see if we can decrease some HAIs. Here's a screenshot from the Get Well there. You can see there it's got a couple of our units on there, and you can customize it to what you're looking for. Of course, most of the time we're looking at monthly. So you can either look at your entire facility or you can break it down by units. And that's usually what we do. We break it down by units and add it on in with our other hand hygiene. Again, just a way to look at that. We're a 1C facility. As from previous, we only operationally have those 57 beds or so that are working at the moment. As far as the inpatients, the rest are CLC and mental health and so we don't get a lot from our secret shoppers. Sometimes 30 or less from a particular area in a month. And as you can see, this data was looks like there's about 2 months worth of data there, and there was over 1,000. We're averaging somewhere, I want to say 400 to 500 a month. from the 3 units combined. So it really increased the number of observations that were occurring. And again, you can see that's just one from the 4J, again, for that period of time. It's one of our med surges. Over 500 observations. And I think in that period of time, we might have gotten 60 from our secret shoppers. So that's, 9 times as many from our patients as we're getting from our secret shoppers. So it gives a lot of good data. And then you can see right there, anywhere from 400 to 500 a month that we're getting. And the results have been really good. We have yes, no, I don't know. And we use the I don't know as an opportunity to remind the staff to be very obvious with their hand hygiene. Again, we saw a very significant reduction in HAIs. It was actually a little bit higher until month 9. We did actually have an HAI that likely probably could have been prevented. In Salisbury, I think about the same thing there. Just to give, we decided to look at the rest of the visit, and some of these numbers are a little alarming, but our Asheville facility has gone on up a little bit. Hampton, full disclosure, they're a very small facility, and so literally they had one HAI of last year, and this year has been unkind for them a little bit here. Durham has actually been decreased. The rest have decreased to different amounts as far as that goes. But we thought for us it was pretty significant to look, and especially since it's something that's already built in for everybody that has get well. And it's just a matter of activating it and see how often you guys want to, anybody wants to use it. Good. So these are the results up to this time, up through March. As far as that goes, and the next steps for us is expansion to the rest of VISN 6. At the time that this was made, there was only a couple facilities that were using it for their CLC, so we're looking to expand into there. And we also have a paper form that has just passed back through the Paperwork Reduction Act that we'll be using for our outpatient areas. This way we can cover, again, other areas of the medical center that isn't generally covered very well by secret shoppers, especially, and things like that. And that's all I have. And again, Mike Rosinski, I'm one of the IPs at Salem, current VISN 6 lead, and the current chair of the Field Advisory Board. Anybody, any questions?
I don't see any questions in the chat. Kayla, did you see any questions come through?
No, not